My name's Dennis Hyde. I've been living in Mount Gambier for the last 74 years. I was playing cards when I had the stroke. We finished playing cards at midnight. I went to walk out the door and that was it. Next thing I woke up in hospital.
Country Health Connect in Mount Gambier is located about 5 hours away from Adelaide. One of the clinics that we run is the driving assessment clinics for clients that have had an incident or a stroke that needs to be assessed to see if they're suitable to be driving. Quite often the specialists are not located in the local area, so they're quite often visiting, or they need to be sourced in Adelaide, so our clients have to travel.
With the driving assessment clinic via telehealth, we have two components. First, they see our clinic nurse, and she is on site at Mount Gambier. She'll go through visual assessments, some cognitive screening tests, and then we'll all catch up together. So the nurse is there to support the client through the telehealth assessment, and I'm on the other end, and we can proceed through interpretation of those assessments done with the nurse.
Chatting to Zoe over the teletext was just like talking to somebody across the table from me. There's no stress, the ease was that it was just like a normal conversation with another person. She just made you feel at ease.
Being able to access the clinic via telehealth allows the clients to access specialist assessments in a timely way. They're not having to incur the costs or the stress associated with travel or being away from home. We think it's really important to collect client feedback, and what we are seeing is that clients feel that they're receiving the same level of care as they would on a face-to-face, and the majority of clients would be happy to recommend or repeat a telehealth assessment.
If we hadn't had the teleconference down here, would have meant that I would have had to travel to Adelaide, make an appointment, family would have had to come there, had to get accommodation, and it would have been astronomical. And it's just too much stress.
Driving can be a particularly important issue for country clients. One, because it's their primary method of transport. There's limited public transport options and taxi services in the country.
It's allowed me freedom, and plus that's what I do for my work. I do voluntary work for Food Bank for 3 days a week.
I think the goal of all clinics is to reach patients in a timely way, and telehealth has enabled us to reach a much broader community of patients.